There are some people who spend more time researching a hotel room than they do researching a doctor or a medical procedure. And today, I'm going to talk to you about why that should end. Whether you're going in for something minor or something major, it is important that you ask these questions. These questions, I tell you, they're going to prepare you, they're going to protect you, and they're going to make sure that you're walking in as an informed partner in your own care, not just a passenger in a healthcare system. It is very important that you begin to ask questions. So if you are referred for a procedure, it's important that you ask, well, what is this procedure and why do I need it right now? Now, it sounds obvious, but it's not. You'd be surprised how many patients just show up, they nod, they go along with the process, and they don't really understand what's about to happen to their body or why it's being recommended at that current time. This goes for surgeries, this goes for facial peels. All of these things. It's important that you ask your provider any questions that you have, and they should explain that to you in plain language. You should also ask, is this time sensitive? Is there some flexibility? Is there a better time to do this? Understanding the urgency or lack thereof of a procedure is actually going to change everything in terms of how you think about a decision and how you plan your life around what you're about to get done. Ask your provider, hey, can you explain what you're going to be doing during this procedure and why we are addressing this now rather than just monitoring this and trying other things first? That is very important. And you always want to think about what are the risks and the actual benefits of having any type of procedure done. You always want to think about your risk versus your benefits. Now, if you look at your consent forms, that's going to list some of the possible risk, but it's always good to have the conversation. So instead of just like signing a consent form, you can ask a provider to actually just talk to you and like contextualize what's actually happening. You want to think about the likelihood of the most common complications and what you should do afterwards. So for someone with your health profile, you want to talk to your provider like, well, what are the most common things that could go wrong? And then that'll kind of help you with your understanding and whether or not you want to move forward with a procedure. Here's a question you can ask. Hey, for someone with my health history, what's the probability of the most common risk happening to me? And then following up, like, what type of improvement can I expect? And as I mentioned before, you want to talk about alternatives. Like, what could I possibly do before I have this procedure that may help me? This one question can open doors that you didn't even know existed. So just always ask for alternatives. Now, a procedure is one solution, and medicine can offer more than one path at different times. So, you want to think about, is this something that could possibly be managed with medication, with physical therapy, with a less invasive approach, no matter what it is. And it's not like you're second guessing your doctor. You're doing a good job as a patient. And we love patients who are involved in their care, who are really vested and asking questions about how they can take better care of themselves. This is very important. There are other questions you can ask, as you are having a conversation when it comes to any type of, procedure. I can go into more details. We can talk about this at an extensive length, but let me know if you found any value in this video. If you did, I will make another video with some other questions that you can ask your provider before having a procedure. And it's not about being rude. It's not about second guessing someone. It's about going into a procedure informed. I'm Dr. Erica R. Jones, MD. I'm here to help you along this health journey. So let me know if you want me to talk more about this.